Hey there, YouTube. My name's Eric, and I just wanted to drop a quick video in reference to ALIF 360 plif, which is a surgical procedure that I am slated to have in 18 days, and I'm in the process of driving up for a pre-op medical testing to make sure I'm okay candidate and that there's no foreseeable issues with having the surgery. And I kind of just wanted to drop some knowledge on you about the procedure, who gets it, why do they get it, what causes of spine issues would you have to have in order to get it, and kind of a little bit of a story of how I got to the point where I'm at now. And part of me is I'm not watching the camera as I'm driving to Philadelphia to the Rothman Institute to have this procedure. Literally one of the best spine facilities in the country, and has some of the best spine surgeons in the world. I'm not going to name specifically who I'm having, but he is one of the best known spine surgeons in the country and is widely renowned as one of the best spine countries in the entire world. But I will say it's at the Rothman Institute. My backstory really involves a back injury I had a couple years ago in the gym, doing bench over rows, pulled something, back spasms, couldn't walk out of the gym. Was literally in agonizing pain no matter how much I moved. So basically I took some time off from the gym and it started to feel better, and I didn't notice the acheness or the soreness that was going on, and kind of just went away, went back to my normal gym routine, did a little bit more stretching. I noticed a little bit of ache, if I slept on my back for a long period of time. And essentially 2 years later, after being at a desk job, of course, for 7 years plus, working in higher education, you're pretty sedentary, which doesn't help your cause in terms of back problems. And I started some P90X. I was running more, riding my bike quite more often than usual, but really nothing different than I've done for the last 20 some odd years as I've been an athlete, in high school, as a kid, baseball, soccer, basketball, year round, including years of lifting, squatting, deadlifting, and the pain just didn't go away. I saw doctor after doctor after doctor. I had MRIs, x-rays, I had multiple spinal epidurals. The only one that I ever even got relief out of was the S1 epidural. Medrol packs, methylprednisone, antibiotics, naproxen, opiates. I know what an opiate withdrawal is, as I have experienced being on Dilaudid for an extended period of time due to severe back pain. And back pain is no joke, and for all the people out there who are suffering with it, I commend you for getting up every day and going on about your life and living it one day at a time, because it really puts you in your place and really humbles you, because it makes you depressed, anxious, upset at life, closed closeted where you don't want to leave the house to do the things that you normally do. Working out is no longer an option. So I basically exhausted all options. I even saw a rheumatologist who told me that I actually saw a doctor refer me to rheumatologists because they thought I had RA. Had multiple blood works for ANA and everything, completely fine. So fast forward to about 4 or 5 months ago, I finally got the insurance company to approve what they call a discogram or a myelogram. And these are diagnostic tools that spine specialists use to diagnose a degenerative disc that doesn't look bad or herniated on an MRI, but looks dehydrated, and they're looking for what they call an annular tear. I had this procedure, no anesthesia, no anesthetic whatsoever. I've got a pretty tolerance to pain, so it didn't really bother me due to the fact that I live in constant pain on a daily basis. And what they do is they inject a spinal needle into your actual disc, and they pressurize it. And by doing so, they increase the pressure on your disc, just like you would if you're sitting on a daily basis. You increase the pressure on your disc much more when you're sitting than you are when you're standing, if people didn't know that. The pounds per square inch are much more. And bam, soon as it's pressurized, exact same pain that I felt. And what they do is they take an x-ray of it as the dye that they inject in your disc starts to migrate out of your disc. And I was 100% positive for a grade 4 annular tear. And these tears do not heal on their own. There is no blood flow or possibility for these to heal, as your disc is a rubbery substance that is kind of like a tire. So after years of seeing multiple doctors and doing physical therapy and trying everything under the book, I finally found the answer as to what was going on with my back. And I wanted to give up every day. It just has beat me into the ground. I feel like an entire different person. I feel like I'm in a third world on a daily basis. And I just felt validated that I knew there was something wrong, and every doctor out there that I spoke to just didn't know what was going on. And this is something that I'm going to stress very important, that when it comes to specifics in terms of a spinal injury, a disc injury, or just a shoulder injury, you want to go to the best doctor that you can, if you're able to and can afford it, in order to get diagnosed with these issues. I believe there's a lot of doctors out there that don't take the time to listen to you. They don't really understand where you're coming from, and to them it's just, you're like sheep, you're cattle moving in and out. And it took me forever to find somebody who understood what was going on, and it's because I went to the best absolute doctor out there, maintained all my medical information, and explained what was going on throughout the 3 years of my suffering. And I finally found a doctor that could honestly relate to me and explain to me exactly what was going on. And it's because they are the finest surgeons in their specialty. So word to the wise, don't slack on looking for the best doctor you possibly can. It really makes a lot of difference. And I feel like if I had been knowledgeable in the past, I probably would have found this doctor a lot sooner and maybe had this surgery quicker. So the procedure itself that I'm having is called an ALIF, which is an anterior lumbar inner body fusion surgery with a plif, which is a posterior lumbar inner body fusion. So what they do is they make an incision below your belly button a few inches, spread your intestines out of the way, and they remove the disc from the front. This allows them to remove the disc much more greatly if they did everything from the back, which means they spar a lot of muscles in cutting into tissue in the back, and allows them to restore the height of your disc much more better from the front than what they would in the back. The plif part of the surgery involves just putting small incisions to put four pedicle screws in 2 rods. This procedure is something that not every doctor is proficient in the US or in the spine specialty field, and you have to be very vigilant in finding a doctor who is well versed in this. And I'm fortunate enough to live on the East Coast, close enough to Philadelphia, as I'm in Virginia, to find a doctor who is one of the best in the country. Hopefully, if he lets me put a plug in, I will later at another time on a post-op or a day after surgery if I'm feeling up to it, and to let everybody know how I'm doing. But I just want to stress to everybody out there that if you are living in constant back pain and you have exhausted every possible option, don't give up. I know that it's hard, it's a struggle. I've dealt with it. I've lost a lot. I've been on disability for about a year and a half away from a job that I enjoyed, and I've lost a lot of money, and it is overwhelming. But don't give up. As long as you have a little bit of faith and you keep at it, I believe that anything's possible, and that hopefully there's relief around the corner for you. I, however, have always been very skeptical about things because of the journey I've been through and everything I've had happened to me, even other surgeries, in between the surgery I'm about to have now. As the spine surgery is a big undertaking. It's not something to be lightly taking, and there are possibilities that I'm going to have segmental issues above my S1 down in the future. That's always a possibility, but if the outcome and benefit of having the surgery outweigh the actual discomfort and quality of life that you're in on a daily basis now, I would say go for it. People out there who are second guessing and questioning themselves, you have to ask yourself, is it worth not being the way you are today versus what you could be tomorrow, and use that as a decision factor in terms of doing this. So for anybody out there who has questions regarding the procedure, or about what I've gone through, or just anything in general, feel free to drop me a line, shoot me a message. I'm going to be pretty vigilant in leaving videos on this, as there's not really a lot out there. There's a lot of people out there who have the surgery, don't follow up, they don't do the physical therapy, and they have a bad outcome. And you see all these people on forums writing about how come they're in such significant pain. Well, a lot of people who end up getting these surgeries for fusions technically never needed a fusion because the problem wasn't really clear cut. And that's where seeing the best doctor possible makes the decision a lot more easier and a lot more comforting in knowing what your problem is. And for me, I feel like I've found that doctor, and I'm not going to have an issue going forward with this surgery. It's not going to be an easy road, but for somebody at my age at 34, an ALIF 360 is the best possible solution for me, as it does mitigate scarring around the spinal canal and possible nerve issues that people have. So again, if you have any questions, comments, feel free to drop me a line. I will hopefully try to direct my responses to you appropriately. And for anybody out there who's about to go through this surgery, good luck and take care. Talk to you soon.